This short video demonstrates how any app can be programmed to access electronic patient information leaflets by simply scanning the two-dimensional barcode. Barcodes containing GS1 identifiers have become even more common, especially in Europe, since the Falsified Medicines Directive came into force on the 9th of February 2019. The app we're using is a simple one that was built just for demonstration purposes, but it's important to note that the majority of the code used is free, open source, and can be used by any developer to create a new app or to add new functionality to an existing one. For our example today, we're using this pack of 252 267 milligram film-coated tablets of Esprit. In line with the Falsified Medicines Directive, 4 pieces of information are printed on the pack: the GTIN, the serial number, the expiry date, and the batch lot number. These are all encoded in the GS1 data matrix. Using the app on my phone, I can scan that GS1 data matrix and there's the electronic patient information leaflet which came from the pharma.be e-compendium. Now, in this case, my phone was operating in Dutch. If my phone was set to French, I'd scan exactly the same data matrix, and there's the leaflet in French, again from the pharma.be e-compendium. But what about other languages? Let's try the same thing, this time in Norwegian. And there's the e-leaflet in Norwegian, this time from the Felleskatalogen. So what just happened? Well, the app doesn't contact the leaflet repositories directly. It goes through an intermediate service known as a resolver, that is, a service that resolves the GS1 identifiers. The mobile app reads the GS1 data matrix, extracts the GTIN, and constructs the GS1 Digital link. It sends the request off to the web along with the user's language, and the resolver redirects the request to the correct leaflet. Of course, this isn't magic. The web address of the correct leaflet for each GTIN needs to be provided by the manufacturer and entered into the resolver's database. Here we see what a manufacturer sees when they enter the relevant URL for the Norwegian leaflet in the Felleskatalogen. And here's the entry for the French leaflet that sits in the pharma.be repository. Now, in this example, we're only concerned with electronic patient information leaflets, but here's another example from a pack of Nurofen, an over-the-counter medicine. For this product, we have 3 different links. Let's look at the first one. We can see on the left-hand side that this will be a link to the product description page. And you can see that here, it's labeled as the default link. What happens if we follow the GS1 Digital link for this GTIN? We'll use the same app, but this time scan the good old one-dimensional barcode on the pack. And we're redirected immediately to that default link, which is to the product description page. But we can do more. We can set the app to specifically ask for the electronic patient information leaflet. And that's what we get. This time, the e-leaflet is in English from the EMC repository. So what have we seen? We've seen a system based solely on existing GS1 identifiers and on-pack symbols. We've seen an app that is based on free, open-source software to read barcodes and convert the data into GS1 Digital link URLs. We've seen that the app calls a resolver, which is where manufacturers have provided the web addresses of the electronic patient information leaflets in different languages. Using the language settings of the phone itself, the user is directed to the correct leaflet in the correct language. We've also seen that the resolver can redirect users to specific types of content, not just electronic patient information leaflets. Do please get in touch if you'd like to know more.